One of the things that makes Shriners Hospitals for Children so different is that when you come here, you may come here for one physician. You may have an appointment with one physician, but what you get is a team. And a lot of our patients don't know that until they have their first visit.
A patient does not have one caregiver, one surgeon, or one nurse, but a whole team of caregivers that are involved in making the stay here and the care the best it can possibly be.
And ultimately, that's the best thing for us as the medical team, because a lot of times we need to talk to one another to work out plans for surgeries, for treatment, for their next step in care. It needs to be a team decision because there's a lot of systems involved in these kids.
We all get to see these children do more with our treatment. We get to see them run faster, walk faster. We get to see them interact with their environment in a way that they haven't before.
When you come here, the parents can have the confidence that they're treating their child the way they should be. That's what a parent wants to know. Am I doing the best for my child that I can? And that's all I can do is try to reassure them that we have.
As the Chief of Staff at Shriners Hospitals for Children, Tampa, my goal is to provide clinical excellence in every aspect of a patient's care. We can help a child who would never have walked outside their own home, and we can provide surgery and then orthotics and prosthetics after the surgery, and both stand there and watch that child walk and watch them kick a soccer ball.
So along the lines with what Shriners deals with on a daily basis with their deformity corrections and scoliosis and different spine procedures, we also have the ability to take care of the sports injuries that we would see, along with anterior cruciate ligament reconstructions or shoulder labral injuries. We also deal with cartilage injuries and dealing with the specialty focus of working on the cartilage restoration and repairing the normal function of the knee joint or shoulder joint to allow them to return to daily normal function, as well as participating in high-level sports.
We have a wonderful scoliosis treatment program here, and we see patients who are very young and have early onset scoliosis, which can be a very debilitating disease if the appropriate interventions are not taken at the appropriate time.
The most common surgical treatment for scoliosis is a posterior spinal fusion in a child who's right around the adolescent growth spurt, usually not completely finished with growth, but as close to that as possible. Up to that time, we generally try bracing, and specifically a custom molded brace. The more reliably and religiously they wear that brace, the greater chance they have of avoiding surgery.
They use growing rods, sometimes the magnetic rods, that allow a patient not to go to the operating room and have their expansions done in the clinic, allowing their spine essentially to grow with them.
So we simply bring them into clinic, hold a device up to their back, hold a few buttons down, make some loud noises, and get another x-ray and send the patient home.
And it significantly has decreased the amount of surgical time, return to the OR, and all the complications associated with that.
So here at our hospital in Tampa, we consider POPS as one of our shining stars. Our physicians work with that department very closely. We confer on what the best device is for that particular patient.
The nice thing about the Shriners Hospital here in Tampa is we can manufacture many different devices. We can manufacture a regular hand to grab something or a terminal device, but also if you play tennis, we can manufacture a device. If you want a swimming hand, we can manufacture a swimming hand. And so all of these are available around the country, but very rarely in one place where you have the surgeon, you have the occupational therapist, as well as special trained people in prosthetics.
I think as a professional, to have that type of service on site means I can provide even better care for my patient.
POPS is a place of healing. Just all you have to do is watch the kids when they come in here and see the look on their face when they're able to do things that they couldn't do before. To allow a child to play sports, to be active, playing competitively on a football team and be the quarterback when he's missing a limb. I mean, these are things that, are just enriching, not just to the patient, but to the people providing the care.
We offer a full variety of services to those patients that are congenital hand and upper extremity patients. We interact with our environment with these tools. If you can better those tools, you can see, just observing the child, how much better they are interacting with their environment.
We provide the most comprehensive hand program in this region, in that we not only have our surgeons taking care of our patients, evaluating their deformities, evaluating their fractures, but we have occupational therapists, we have orthotists and prosthetists available to see that patient, and often all of them are in clinic at the same time.
Osteogenesis imperfecta is a disease that affects the bones. Most commonly, it's a mutation in collagen, which is what gives bones its strength. It makes their bones very weak, and that's why it's also called brittle bone disease.
I've been a patient at the Shriners Hospitals for Children in Tampa since I was about 3 weeks old. The quality here is uncomparable to anywhere else. You walk in and it doesn't feel like a hospital. It doesn't have that hospital smell. You don't see the sterile walls. It's very homey and welcoming and safe feeling. And I walk in and I see staff that have been here since probably before I was even born, that know who I am and I know who they are. And it's so safe feeling. I always say the hospital is like my second family.
I mean, you can go your entire career as a doctor, as a pediatrician, and never meet a child with OI. So to have a place like Shriners here for these families who the nursing staff, the physical therapists, every department has knowledge in osteogenesis imperfecta. We have the team, we have the knowledge, and we have the desire to keep learning and keep changing.
I don't know what a child's going to do when I provide treatment. They surprise me. And that's really the best part of my day, is seeing my children come back post-surgery, post-orthotics, post-prosthetics, post-therapies, and see what they do.
The doctors, nurses, and staff that support Shriners Hospitals here in Tampa and elsewhere are actually some of the top doctors in the country, and even in the world for their specialties.
This is a place of clinical excellence, and that is clinical excellence for any patient who walks through our door.
We provide very unique care to a very unique patient. And it's important that we provide that care regardless of the family's ability to pay.
What that really means is that we get to provide the best care to every patient. We get to spend more time with them. We get to provide them with the optimal prosthetic. We get to perform a surgery that in other hospitals, they're not allowing their staff to perform because it's too expensive. Well, if it's the best thing, we get to do it.
One of the best things I like about Shriners is about that they take care of me, and I love Shriners Hospital.
Without Shriners, I don't even want to think about it, honestly. They have given me every tool in life to be successful, and it's really scary to think where I would be if it wasn't for them. They've given me everything.